Joining me now is Senator Sherrod Brown, a Democrat from Ohio. Senator, thank you for being here. Let's start sort of big picture, then we'll zoom in more on your state of Ohio. Medicaid covers 20% of all Americans. It covers 49% of all births. It covers 60% of children with disabilities and 64% of nursing home residents. How are your colleagues on the other side of the aisle justifying giving tax cuts to the rich in exchange for hurting those people?
Well, they deflect attention from that. That's why your open was so important, that you point out that this is primarily a tax bill. A tax bill should be gone through the process as a tax bill, not as a health care bill. One thing that the only thing you left out, Joy, is that those meetings that you said are all male senators and all white male senators in McConnell's office. The people you left out were the insurance company lobbyists and the drug company lobbyists and the medical device company lobbyists. So while you say $2 out of $5 are tax cuts for the 1%, true, the 400 richest families in America will average a $7 million tax cut. There's huge tax cuts for the medical industry too. That's why those drug company lobbyists, insurance company lobbyists, medical device lobbyists were in there writing the bill too. So you start with that. I don't know how they justify doing this. A huge tax cut, a huge wealth transfer from middle class, working poor to the wealthiest people in the country, as if the chasm's not big enough in the United States of America anyway.
Well, I think it's been difficult, to get Republicans to come on and justify it. We did have one yesterday who pretty much admitted that he wants to make sure that his constituents, the taxpayers in his district, don't pay for Medicaid because he thinks it's unfair. So I think some are being honest about it. But let's zoom in a little bit and let's talk about Ohio. Medicaid, among the other things that it does, that it is really, the expansion has helped to combat the opioid epidemic, which is acute in the state of Ohio. Medicaid accounts for, according to the statistics my producers were able to find, 24% of all opioid addiction treatment prescriptions nationwide. 1.2 million people who've been covered by the expansion of mental health and substance abuse issues. Another, Ohio happens to lead the state in fatal opioid overdoses. At least 4,149,000 Ohioans died from overdoses just in 2016. That's up 36%. And I want to let you listen to your fellow Senator Rob Portman talking before the bill's release about his concerns about the Medicaid expansion being rolled back and how that might impact the opioid epidemic.
Well, my concern is that some people who are getting treatment currently under expanded Medicaid in particular, which is the change in the Affordable Care Act, might not be able to continue to get that treatment. So we're working on that issue, and we've made some progress, but we're not there yet.
Would you vote for something that takes that away?
So, Senator Brown, he did not answer whether or not he'd vote for the bill. Do you happen to know whether your fellow senator is going to vote for this bill anyway?
I assume he hasn't decided yet. I obviously don't speak for him. Our relationship is good. We fundamentally disagree on the rollback of Medicaid. I mean, I'm with Governor Kasich on this, a Republican governor in Ohio, who expanded, under the Affordable Care Act, we gave him the opportunity to expand Medicaid, which he did, to 700,000 people. The key number here in Ohio, and it shows the heartbreak in how sad this is and what a public health challenge it is. 200,000 people right now in Ohio, 200,000 people in my state alone are getting opioid treatment because they have insurance from the Affordable Care Act. And what Republicans are going to do is put a little pot of money in this bill. They're going to scale back Medicaid, throwing those people off Medicaid. They're going to put some dollars, a little pot of money, and they're going to say that's to take care of opioid addiction treatment. But you don't treat it with a grant. You wouldn't cut cancer treatment and then say, okay, we're going to give you a federal grant to do cancer treatment. You want to insure people so they can get everything from education to prevention to counseling to medication-assisted therapy. It needs to be a comprehensive health care program for each individual Medicaid beneficiary, and that's what Medicaid does. A grant like this will do nothing. So I'm hopeful that Senator Portman and Senator Capito in West Virginia, who are getting it every bit as badly, the opioid epidemic's just as bad in that state as mine, that they stick with the Medicaid way of doing money because it's the only way to address this public health crisis.
And Ovik Roy, who was on our show yesterday, a Republican, who's been working on these health care issues for a long time, used to work with Mitt Romney. He has called this bill, if it passes, a positive, revolutionary change because, in his view, replacing Medicaid, the Medicaid expansion, with refundable tax credits for people who are 125% of the poverty rate, giving them refundable tax credits is a better way for them to access health care. What do you make of that?
Well, it sounds to me like somebody's, again, deflecting the whole issue that this is a major tax cut for the 1% and for the major insurance, drug company, medical device companies, taking money from working class, the working poor, and transferring it to the very wealthy and dressing it up in some kind of nicer package. And in the end, it's absolutely a wealth transfer. It attacks the people who are under the most duress in their lives, whether it's opioid treatment or whether it's cancer treatment. Keep in mind, Joy, most of these people that are getting assistance under Medicaid expansion are people that have jobs. They just don't have the benefits that you do in MSNBC, the health benefits, or I do as a member of the United States Senate. This is what's particularly morally reprehensible about this. You've got 250 or 300 members of the House and Senate who have taxpayer-financed insurance, paid for by taxpayers, taking insurance away from so many others so they can give the wealthiest people in this country a tax cut. And that's what's so reprehensible. I ask people to go to SherrodBrown.com, sign our petition to fight against this in these last 3 days. It's going to be a close vote, and everybody needs to weigh in across the country with their House members and their senators.
Senator Sherrod Brown, thank you so much for joining us this morning.
Thank you, Joy.